Is blood cancer curable? This is a question that I would like to answer in this particular video. Hello, I am Dr. Soumya Bhattacharya. I am consultant hematologist, hemo-oncologist and BMT physician attached to Apollo Multispecialty Hospital, Kolkata. Blood cancer is not a single disorder. There are multiple disorders which we club together under the same heading, blood cancer. For example, blood cancer includes leukemias, lymphomas and myelomas. So these are the three major subdivisions of blood cancers. Again, if you look at the leukemias, there are two broad classifications: acute leukemias and chronic leukemias, and of which in the acute leukemia there are two subdivisions again: acute myeloid leukemia and acute lymphoblastic leukemia. And in chronic leukemias again there are two subdivisions: chronic myeloid leukemia and chronic lymphocytic leukemia. With this introduction, I would like to say that there has been vast improvement in the management and treatment of different types of blood cancers, and a lot of people are getting better, if not outright cured. For example, in acute lymphoblastic leukemia in children between the ages of 2 to 10 years, if appropriate treatment is given timely, then there is a success rate of about 80 to 90%. That is, if 100 children with acute lymphoblastic leukemia is affected, then with proper treatment 80 to 90% of them will be completely cured. Then again, there is a condition called chronic myeloid leukemia. This used to be a killer in the past, but nowadays with a revolutionary new treatment called imatinib, which is a tyrosine kinase inhibitor, these chronic myeloid leukemia patients are having a very good quality of life. A lot of them live very long, and the treatment is not expensive and it can be taken in a tablet form. So no expensive or toxic chemotherapy is involved. And with this treatment, the management of chronic myeloid leukemia has become as easy as diabetes management. In chronic lymphocytic leukemia, which is another type of chronic leukemia, there is also a plethora of new drugs. And with these drugs, we can keep these patients going for long periods of time. And in fact, there are certain conditions in cases of chronic lymphocytic leukemia where we may not even treat the patient in the early stages. So yes, the patient has a cancer, but we don't treat it. In multiple myeloma, then again there has been tremendous advancement. A lot of my multiple myeloma patients are living for 10-15 years, and a small section of them, especially after transplants, are getting cured. If a patient is free of the disease for 15-20 years, then one has to assume that they are cured. So that has been the fate of quite a few myeloma patients of mine, but not all. As regards lymphoma, there are different subtypes of lymphoma. Hodgkin's lymphoma in young is eminently curable. With modern treatment, up to 80% of Hodgkin's lymphoma patients get cured and lead normal lives. There is a subtype called diffuse large B-cell lymphoma. Here also, with appropriate treatment, 50 to 60% cure rate is possible. So my advice to you would be that if someone has a blood cancer, don't despair. I won't claim that all blood cancers are curable, but some cancers are definitely curable, and some cancers it's possible to keep controlled on a long-term basis, so that the quality of life is not impaired and the patient leads a productive, happy, healthy life.